I am so happy to be here today and to talk to some of the leaders of PEF, which is the Union of New York State Social Workers, and several other titles, which they'll tell us about. My name's Sam Fletcher. I'm the Executive Director of NASW New York State. We are just going to go ahead and jump in and get started. So I am going to ask, when you answer for the first time, if you will introduce yourself, tell us your name, tell us your title, a little bit of what you do. My first question for you is, what is PEF?
So good afternoon, Sam, and thank you so much for having us today. My name is Randi DiAntonio. I am a licensed master social worker, and I am also the vice president of PEF, the New York State Public Employees Federation. PEF is a union of professionals who work for New York State agencies. We represent over 3,000 titles, and social workers are one of them, and we provide essential services to New Yorkers. We work at the Office of Mental Health, the Office for People with Developmental Disabilities, Alcohol and Substance Abuse, Children and Family Services, and many, many more. But we at PEF support our members. We are a union, and we are always looking to not only improve working conditions, but the services we provide to those New Yorkers in need.
I have a follow-up question to that. So does every person who works for the state, are they members of PEF? Do they have to opt in to be members? Or how does that work? And if you represent 3,000 titles, do you know about how many professionals you represent?
So PEF represents all the titles in New York State agencies that are classified as professional, scientific, or technical titles. So they encompass a lot of different career paths. However, I think, for the most part, most of our membership opts into the union, but since 2018, a Supreme Court decision called the Janus decision occurred, and that gives people who are employees in PEF represented titles the ability to opt in or opt out. Thankfully, we have maintained our membership levels at the higher numbers that we need. But it is possible now with those changes that people have a choice. I think for the most part, our members know the value of being in a union and being represented by a union and having an organization that fights for them on the job and fights for the services that they provide. But yes, it is a member option, an employee option. So
Gina, do you want to jump in and add anything?
Sure. Hi, Sam. My name is Gina Corona. I am a LCSWR and LMSW2 with the state. I work in Syracuse. I'm also the regional coordinator for PEF. I would concur that our membership is a primary focus. We do everything we can to recruit and retain our membership, and show them the value of the union. They could potentially not opt, but many of us who are speaking to them at the onset of when we meet them, we call that new employee orientation. We speak to them about the value of being in the union and what we offer versus being a non-union member. And a lot of that is around support and helping them through some of the toughest times, which is usually a probationary period. And then also showing them the opportunities for career paths.
That is great information for people who've never been in a union. I worked for New York State, but I wasn't a part of the PEF union because I worked at the university, and I just knew I paid the dues and they sent me emails and everything, but I wasn't involved. So it is really good to hear leadership talk about what it entails and what you're doing. I think that's very important.
Yeah. We also let them know. Sorry.
No, go ahead.
We also let them know what we do as far as activities and committees that we have. We ask them if they want to be involved. We also need their input because they're also coming from a different place. They're coming into state service. So they have something that they may now offer us, and we can have a dialogue with them about, what we do differently, what they do differently.
I think it's one of the things that always struck me as a social worker is being part of the union gives you a platform for grassroots advocacy, not only on your own behalf, but on behalf of the people you serve. And I think that has always been very appealing for a lot of our members, that they have a voice to speak out, to be heard, to advocate, to do what social workers like to do, which is to make sure that they are helping others. And I think for the most part, our members realize there's strength in numbers, and that we are the exclusive bargaining agent. So we represent them not only at the contract table, but also at the labor management table, where we can have conversations as equals with the employers, and really make a difference in your day-to-day work life. So I think that that's an important thing that, many state workers, if they're not active in the union, even though they may be members, may not realize that there is a voice that they have, if they choose to have it at their workplaces.
I think you drew a really good comparison there, because social work roots, there's a lot of roots in union work at the beginning of the profession. And to draw that comparison back to, like, this is still our calling, and it's such a natural fit for social workers to be in their union and to be active in their union, which makes sense because both of you are social workers in PEF and you're active in your union.
It's everything you do as a social worker to be a union activist. You are problem solving, you are dealing with crises, you are strategizing on, solution focused things that you can do to make things better. So it's a lot of the same skill set that, you have as a leader or an activist as you do in your social work fields, where you're helping somebody strive to, improve something.
It's every day is like at work in the hotline.
I think it's such a good explanation, because I know there's social workers who don't have the option to join a union in their current job, but we do have social workers who work in other places that do have a union, and they may not understand the role of the union and what the union does. And then, of course, the state is always hiring social workers, as you're hiring them right now. So you're hearing from the leaders why this is a good job and the extra protections you get being a state social worker. And go ahead.
No, it was always really encouraging to me as a social worker early in my career as a licensed professional, that I realized if I didn't agree with management or with what they were asking me to do, I had the ability to say something in return, like, I'm a licensed professional. I'm not going to change my opinion. This is what I think this person needs. And there's a lot of pressure when you work in an agency or you work somewhere where you don't feel like you can speak up and push back if there's a reason to do so. But when you work for the state and you are union represented, you do have the ability to stand, not that you don't in other places, but you have the ability to say, yeah, wait a minute, and to not feel like your job is at risk by doing so.
And it's a process also of empowerment. Not everybody is aware that they can do those things, but as you engage your members and you educate them as to what their rights are, then they become empowered and they share with others. And I'll tell you, it's really profound, but the evolution of a strong council starts with having people who are on the ground and you've helped them, and then they hear other people need help. And so when they find that their coworkers are in trouble, then they call you, right? And they say, I have so-and-so on the phone and they need to talk to you because something's not right. And so that's how I think we really start to build on the strength in numbers, because one person believes, has a good experience, shares with others, and then it spreads.
And I'll just add, I think the one thing that I find very unique to PEF is a lot of the things that we fight for are not necessarily specific to our jobs or working conditions. It's about services. It's about what people in our communities need. It's about, you have patients that have needs and there's no safety net. And so when we speak out, it's the social worker thing. We're not always looking to help ourselves. We're looking to help others. And I think that comes across very clearly in a lot of our advocacy efforts.
Well, and I think we've always talked about union rights are human rights, and we protect each other and we protect our patients.
I think that's the perfect segue into talking about your campaign of Fund Our Future. Like, I think you just set this up perfectly. So can you talk a little bit about that and explain to people what this campaign is about and the different work and different activities you're doing with it?
Yeah, absolutely. So Fund Our Future for a Thriving New York is the full campaign title. And it really goes back to the roots of who we are as public employees. The reality is that over the last decade, 15 years or so, public services have been diminished greatly. Under the last administration, unfortunately, our budget was capped. We were not able to hire. A lot of privatization and contracting out occurred. And at the end of the day, that impacts the care and the services we provide to New Yorkers. So Fund Our Future is a multi-year campaign. PEF is part of two larger unions, our parent unions, the American Federation of Teachers and the Service Employees International Union, SEIU and AFT. And we took two campaigns they were working on and we kind of morphed them together. Fund Our Future originated from AFT fighting for K through 12 funding, and SEIU was fighting for communities to thrive. And when we look at what PEF does overall, we provide services across the gamut, from the Department of Labor to DOT plowing our roads and engineers building our bridges, also to serving the most vulnerable citizens amongst us. And this campaign is about bringing it to community. It's about letting our neighbors, our friends, our church groups know that public services exist to serve them, and we need their support. Because for a very long time, the reason that people bought into cutting public services is because they're tax dollars. And, we don't want our taxes to be high. But at the end of the day, if tax dollars are spent appropriately, all New Yorkers will benefit. And I think COVID magnified that in a way that nothing we say or do would have been able to. When COVID hit, it was our workforce that stepped in, that didn't get to stay home, that was out in our facilities, in our correctional centers, in our developmentally disabled group homes, making sure people who needed unemployment services got them, the gamut of call centers and setting up COVID testing. Those are all public services that are funded. And we needed to get a message out to the average New Yorker that we need their help to make sure that this governor and our elected officials understand the importance of reinvesting into state government and reinvesting into a workforce that frankly has been cut and decimated. We have less members than we ever did because of those cuts. We've seen a lot of people, not stay in state service because it is difficult work and can be exhausting work. But this campaign is about New Yorkers. It's about making sure New York has an essential workforce that can respond when our public needs us to. And we are partnering with not only NASW on some of these issues, but we're partnering with other stakeholders, fiscal policy folks who look at tax dollars and says, we want it to be in the public interest. We want to make sure money is spent that it helps the largest majority of New Yorkers. And so this is a multi-year campaign. We know that it's a big lift. We can't get everything at once, but it's changing a culture and it's changing a tone of how state government is treated and how it's viewed. Because I think most New Yorkers don't realize who works for their government. It's us. It's social workers, it's psychologists, it's teachers, it's, engineers, it's, rank and file members who do the good deeds that make your communities and your neighborhoods, livable and safer. And I think this campaign has something in it for everybody. I mean, one of the other big foundational issues that we're looking at is we understand there has to be reforms in criminal justice, but we want to have a seat at that table because we represent people that work in that field. And we think it needs to be done, but it needs to be done in a way that actually is going to work for not only the people being served, but also communities. We're also looking at the civil service system. We know civil service jobs provide a step up into the middle class in a way that very few other positions or work systems do. communities that are typically underserved or typically have intergenerational poverty, getting a civil service job means you might be able to buy a house, you might have health insurance, you have a pension. You know, this is a vast shift from most of the jobs that are out there right now, which don't provide those benefits. So I think it is a large push to get state services to be as robust as they had been in the past, and to make sure that we get the support of the public.
I would even say, Fund Our Future, we represent so many titles, but it speaks to social workers, because we just discussed how often caseload sizes are impacted by those leaving, and they're leaving because they're not getting what they need in order to do the job that they were hired to do. Fund Our Future, the campaign, our hope and our outcome is that we build the workforce to take care of our vulnerable citizens. Our social workers are left many times with impossible caseloads and impossible tasks. So a goal of rebuilding the workforce to be able to go back to doing the good work that we were doing is a wonderful goal.
Both of you talked about something I want to bring up and just have you maybe expand on a little bit. When you're talking, you're really talking about that the state jobs create a safety net for our communities and for people who don't have the money to go hire a private therapist or to go to get even medical care, and pay out of pocket for these things. And you also brought in that the jobs create that stability for the workers as well. So it's almost like this loop of taking care of the most vulnerable New Yorkers by providing the jobs and then also providing the services. Do you want to talk a little bit more about that? Because I just know most people I know do not have the money to pay out of pocket for any services, any of them. So
Absolutely.
Can you talk more? Yeah, go ahead.
Absolutely. As a safety net, as an employee at a safety net hospital, we frequently run into families who, even with the best of health insurances, can't afford a $25 copay once a week. So, we have to account for that when we're scheduling sessions, when we're talking to our billing department. But at the end of the day, New York State, when we're able to do the good work that we do and we give back to the family, the child, the adult, the stability they need in order to maintain themselves as productive citizens, we're giving back to that community, and then they're giving back to that community. So I think it's, very important. I don't know what, Randi, do you want to add more?
Yeah, I think that, the one thing I would like people to understand is the state doesn't turn people away.
Right.
And I think I'm not judging that, because I know there's a lot of factors that go into whether you can safely serve somebody. But in the state system, we are the provider often of last resort for people. And we see it regularly where people end up in our system because they haven't been able to get the services they need elsewhere, whether it's because they can't access them, they can't afford them, whether a provider doesn't get reimbursed to the degree they need to maintain financial solvency. We know that the more complex, challenging individuals may need more services, more time, more supports, and those often cost more money. And so we see a lot of people that end up with us that have been shifted or moved from provider to provider to provider, and they don't know where else to go. And, we are the folks that make sure that they don't fall through that last crack. So I think it's really critical to know that the state has a constitutional obligation. We cannot turn people away. We have to provide those services, whereas other providers have more options to do that. And I do think that is a significant distinction.
I really like that you brought that point up. I lived in Oklahoma for 30 years, and Oklahoma is not a state that provides that wraparound support for the citizens. I was lucky enough that I'm a member of the Cherokee Nation, and I didn't have insurance for years, but I had access to the tribal and the reservation hospital that I was able to get medical care, but I would have had no medical care and no access to services without my tribal affiliation. And when I moved to New York, now it's been, 19 years ago that I moved here. That was one of the first things I noticed, is that New York takes care of its citizens. And I think people who are native New Yorkers don't understand this does not exist in other states. And it's such a privilege to live in a state where you will get help, and that the state does have this safety net. And people go through crises at all different points in their lives, and you never know when you need that safety net of support.
I mean, what you just said is the whole reason we're investing into the Fund Our Future campaign, because for the last decade, we've seen closures of our facilities, the programs that serve the highest need individuals. And then you see these tragedies across, the headlines of different papers, somebody mentally ill, freezing on a bench, somebody hurting somebody else, a person with a disability ending up in the prison system instead of in our system where they might get treatment. Those are all a result of lack of investment and believing that we can do more with less. And at some point, that just doesn't work. Those who have the highest needs and are at the highest risk are the ones that are harmed the most. So I think, we can turn this ship around, but we have to have the support of other New Yorkers. We have to have the support of our elected officials. And some of this is an education and awareness issue. We have to let people know what we do and what's missing because of not having enough services, not having enough funding, not having enough support for programs. And, I never disparage other providers, but the state has to be the provider that is the most robust, because we know that when everything else may not be able to respond, we have an obligation to.
Absolutely. And I would even say, Sam, it is so little known, but our doors never close. We are a walk-in clinic at any point in time. I'm in an outpatient clinic. If someone walks in, they will immediately receive services. Yet we hear about people having tragedies all the time because they couldn't access services, because it's very little known and very little publicized. But any given day, a parent, a child, or an individual with mental illness can walk into one of our clinics and say, I need help. And we will sit them down, we will talk with them, we will give them an assessment, and then we will triage them and give them a next appointment. That is just absolutely one of the most important things about what we do, because we are there for New York when New York needs us.
I think you just nailed it. And we want to help promote this, what you're talking about, and getting that word out in any way we can, because what a powerful statement. You can walk in anytime, and New York State has the safety net. I think you both have done such a beautiful job of explaining why Fund Our Future is such an important campaign, and why, people need to know about this campaign and know why it's important, and to understand that there were all these cuts, and now we have to build that back to make sure we have that safety net and we're not burning out our workforce. Because of course you're burning out your workforce when you don't have enough employees to meet the need.
Correct. And we saw what happened, with nurses. We saw, and this didn't happen overnight. It wasn't COVID that caused this. This started long before COVID. Female dominated professions, nurses, social workers, teachers, and the list goes on, have been devalued for many, many years, both in pay and in treatment. And at some point, people got tired of feeling that they weren't being respected. So we've seen this shift in interest in going into the field, but also in staying in the field, because it is such difficult work. And, sometimes it's not always as rewarding as we'd like it to be. But I do think there is hope. I've seen a shift in, our voices being heard at the state capitol. I've seen a shift in the governor's office as far as a recognition that we need to rebuild certain professions, that we need to look at pay inequities, that we need to look at safety net services in a way that we haven't in a long, long time. And so I'm an optimist. I believe that we have a chance to make a difference here, and we're going to take that opportunity to speak out every chance we get. But I'm also a realist, and I know that it's going to take time, but it's going to take the support of other social workers. It's going to take the support of parents and families and other groups of people that have a stake in this. We all have someone we love or care about that needs services at different points, regardless of which agency. And if we don't have a government that can be responsive, it hurts everyone.
I absolutely agree. I never became more aware of politics until I had a child with special needs. So I agree 100%. Much of my advocacy has been around children and special needs, and I'll continue to do it till my last breath.
I think this is a perfect segue into what is PEF doing for social workers? And I think you prefacing that with a female-dominated profession and talking about the challenges behind that. And I've been able to witness a lot of the work that PEF has done. I think it's really important that everyone hears what you all are doing for social workers. So please explain that.
Sure. I'll start and then I'll kick it over to Gina. So, PEF, as I started, we represent a lot of different titles in state government. Social workers are at the top of our list. And when we look at titles that have been devalued, we have a number of them. So we're juggling those. But social workers clearly provide a vital service. And so over the last couple of years, we've been talking primarily at the Office of Mental Health, which holds the largest number of our social worker titles, around some of the issues around staffing, recruitment and retention, pay equity, and Gina can go into that a lot more. But more broadly, over the last 6 to 8 months, we have seen some successes with other titles that we wanted to piggyback on. But we knew that in order to be successful, we had to do a couple of things. We had to collect data and stories. We had to identify alliances, and we had to start talking with our elected officials about the critical needs that we needed to deal with immediately to avoid a catastrophe, because we're already in crisis. So we work within the New York State civil service system, and changing job titles and pay is a process. It's a step-by-step, labor-intensive procedure that you have to prove certain factors in. So over the last 6 months, PEF has been collecting data. We've surveyed our membership. We've been meeting with various stakeholders such as NASW. We have been partnering with various stakeholders around legislative issues, and we will continue to do that with your support. And I think it's a work in progress. I'll let Gina speak specifically to her role in OMH, because that agency, we have about just under 1,200 social workers we represent that are licensed. We also represent social work assistants that are not. But the largest chunk work out of OMH, over 900 of them. So I'll turn it to Gina to talk a little bit about the work she's been doing with her team.
So Sam, everything starts local. For me and my advocacy, it started local, at the LM table, just reporting out what social workers were reporting to us, the increased acuity, the increased caseload sizes, how I met you, reaching out to NASW to say, hey, we need caps. We need some type of governance, because, not backfilling and dispersing people is important. And we need to make sure that we're able to do the things that we need to do. That dialogue then generated to the statewide labor management table, where we continue to have the dialogue for outpatient, for inpatient. We continue to advocate. While we may not agree on caseload sizes, I think that we've come to some consensus that social workers are not happy. There are things that they have identified that they're not happy with. And we've been able to engage at least in a conversation about how we can come together to make things better. I personally advocate for social workers and their ability to ethically do the job the way in which they're supposed to do it. I know that you and Evelyn and I have also had conversations about this and how to empower social workers on the ground, right? To express their supervisors or at their labor management table that, this is a problem and what they need. And we continue to have the dialogue. I think Randi did a nice job of kind of giving where we're at today, but this has been a process over 10 years. The increase in the caseload sizes didn't happen overnight. It was the lack of backfilling and the leaving of the state workforce, the retiring, not hiring, and the influx of patients and not hiring to accommodate that influx. So I think we're in a good place. I think we're having conversations that are important to movement, and we'll continue to do so.
And I think just to piggyback, the other thing, we are advocating for all of the differences in increased titles and pay and all of those things, but we're also speaking up about how the services have been cut and diminished, because for a lot of social workers, their biggest frustration is their clients and not having places to discharge people, not having resources in the community to safely serve people. We hear from social workers who are working their rear ends off. They have doubles and triple caseloads, and they care deeply about the impact of that as it relates to the work they're doing with people. So they may feel burned out, and many do, but when you talk to them, what they talk about the most is, I don't have enough time to see my patients. I am being asked to discharge people before they're ready, because the state cut like thousands of beds. They closed many of our programs without a real plan or investment into other types of services. So you see a professional reaction to that of like, hell no, we're going to fight to reinvest, to reestablish programs that actually took care of the people we want to take care of and we need to take care of. And I think, we're pushing on a number of fronts, not only in the workplaces to make working conditions better and on the pay front, but also on the service front, because you can't fix this problem by pulling out one piece of the puzzle. There's a lot of pieces involved. And yes, it's step by step. So we may have one win here and then we got to start focusing on another, but we're social workers. We multitask. That's what we do.
One of our biggest challenges has been trying to manage the loss of services in the community. Many of our social workers are clinicians working in inpatient or outpatient settings. And the ancillary support services were critical to the work that we did. 50-minute hour is only as good as the information that is taken out of there and utilized in the real home setting or community setting. And many times we relied on the ICMs, the intensive case managers, supportive case managers, the ACT team to support our patients in between sessions. We don't have that anymore. And many of us are doing above and beyond case management, supportive services, and trying to manage these crisis calls in between. So like Randi was saying, we really feel passionately about our clients, and our advocacy really is their focus. That's what we do. We're social workers.
I've had the privilege, I mean, Gina, I met you. You're, I think, probably one of the very first members I met when I came here 3.5 years ago. So I've been aware of what's going on with the social workers at the state since I got here because of you and the caseloads and, you talking about that and the impact. And then really in the last 6 to 8 months, I've had the privilege of partnering more with PEF in a professional capacity. And what has really impressed me about the social workers is exactly what you just said. While they're clearly underpaid and have an increased workload that is impossible, no one could do what they're tasked with doing. That's what I hear about are the clients and who they're serving and how they want to serve them. I think the other thing that I've been so impressed with is how these social workers are doing work outside of their job to change this situation. They are involved in the research, they're involved in writing, and they're involved in being a solution. I have not seen such a hard working group of people come together and say, what is happening is unacceptable. And so we will give our time to make these changes. And it's been exciting for me to see that, to see the social workers in action.
Sam, it was,
Yeah.
sorry. I was going to say, there was a lot of reaction when certain titles received what they would say would be accolades, the GOPs and stuff, and they were left out. And they were very passionate about the work that they do and that they were not recognized. And Randy knows I started a Facebook page because I felt like it was an important place for people to support each other, to talk about this stuff. And I never seen the numbers go up so high in my whole life. But it became a forum for people to talk to each other, collaborate. And I think that probably fed into and generated a lot of the fuel, Randy, for where we're at right now.
Yeah, I mean, listen, I got an email from one of the lovely folks on our team saying she was getting text messages during our town hall the other night that they finally feel heard. And I think that's a critical piece. Even though we've been working on this and having these discussions, they didn't feel like they were part of it, and they do. And I think, like we started with, we can't do it without our members. We have strength in numbers. And, as leaders, we can talk about these things, but we need our members to tell their stories, to share what they see and hear on a daily basis, because that's what moves hearts and minds. And I am proud of the work we've done in the last few months in, writing up an analysis and making sure that the survey results are going to be shared with the right people and pushing the right people to look at this, and with your help and NASW's help in partnering, because we know, social workers in general are underpaid and devalued. It's not just those in the state service, although that's our focus. We believe that it's a really, it's a righteous fight to have, and we're going to do what we can to make a difference there. So I invite all of our social workers to join forces, because we can't do it alone.
I completely agree. And as you know, at NASW, we are on this push right now for social work salaries and for those to increase across the board. And I think New York State has a real opportunity to be the leaders in that, and to make these changes in the titles, to pay social workers what they have earned to be paid, to make a pay and a grade that is equal to the education and the experience that the social workers are bringing into the job. So I think New York State, let's lead this. Let's lead this by example. Let's pay the social workers more, set this example that we have to pay all social workers more, or we're not going to have social workers, because people will leave the field to where they can be paid and appreciated.
Absolutely, 100%.
Yeah, I mean, we not only deserve it, our clients deserve it. And frankly, like we've all talked about, we are in a crisis right now, and they can either go the right way or the wrong way, and that will determine the outcome. And timing is everything, and we have to do something now.
Sam, a lot of people will talk about social work as an art of the heart, and it is true. Many of us feel passionate, but we also know when we're not heard, we're either going to fight harder or we're going to throw in the towel. So I'm really hoping that our fighting harder leads to the results that we really deserve and desire, because to have a workforce that is so depleted and then have more people leaving just leaves some of the most vulnerable people without care. And that would be a terrible thing to happen.
Absolutely. And we all know social workers are, compassionate people. We are very tapped in, and we want to make people's lives better and to help them make their lives better. We all know that. But I completely do not agree with this, statement and this idea that social workers shouldn't be paid. That's insane. We don't ask that of other professions.
No,
Like,
Right.
someone
yeah.
said to me earlier today, when I was in social worker school, they used to say it's the outcomes, not the income that matters, right? And, we know that outcomes matter. We care about that as a priority, but that doesn't mean we should be able to pay our bills. That doesn't mean that having a license and a master's level education and credentialing and all of those things shouldn't be respected and valued and treated with, the dignity it deserves. So I think you don't have to have, one doesn't have to be without the other. It's not an either
Right.
or.
We deserve to make a living wage. We deserve to be able to take care of our families and take care of ourselves while we're taking care of our clients. As a matter of fact, it would be critical for us to be able to do that, to take care of our clients, because if we're not healthy, they can't be healthy.
Absolutely. And I think it goes back to what you were talking about with the female driven fields, because I've never heard of a male dominated field, such as engineering or safety type jobs, to where they say that they should just do it because it's the right thing to do, that they shouldn't be reimbursed for their skill set, for their education level. So why would you ask that of any other field? And I feel very strongly that I deserve to be paid, and I feel that every other social worker deserves to be paid.
Yeah, look,
Yep.
I think our salaries and the disparities are really a form of discrimination and misogyny and longstanding historical devaluing of the helping professions. You look at different titles in the human service field and what's valued and what's not. And when you see like researchers and analysts and psychologists, I'm not disparaging those folks, but they have the same level of education or less in some cases, and their work is treated differently. And I think there is a historical issue here with how these professions were treated and how they've evolved, and they're not seen the way they need to be.
I completely agree. And I am so happy that you're doing the work to change this. And I do want to ask, is there anything else that you think is important to share about PEF, about New York State social workers, anything that you think is important?
I just want people to know that, we work really hard with the citizens in New York that have some of the most complex, challenging issues, and we will continue to do that. But as a union, we also know we're going to fight for our members and to make sure they're treated with dignity, with respect, that they're paid fairly. And we just ask for support. We believe that what we do is really important work. And we just want to make sure that everybody out there knows that and stands alongside of us, because we don't want that safety net to be shredded any more than it already has.
I would agree. I would add onto the safety net, we offer some of the best continuity of care. Many of our social workers, many of our state workforce come and they stay. They want to build a career. And so we pass that on to our clients by staying and offering that continuity. The best thing we can do for them is to not have turnover and to really preserve the workforce so that we can deliver the quality of care services that we want to and they deserve.
And my last, plug, if people are interested in becoming New York State social workers, there are very significant benefits to being a state employee, to being represented by a union. We have a lot of benefits that directly affect social workers related to, continuing education and professional development, related to licensure, and relating to having a career where you do have, a retirement pension at the end of that career. So there's a lot of value outside of the work itself, which is critically important, to becoming part of an organization of a field that, gives you some different options as a social worker.
Thank you both so much for your time. I very much enjoyed talking to you.
Thank you,
Thanks.
Sam. We so appreciate you and all the work you're doing at NASW. You know, we wouldn't be as far along in this process without you. So I thank you.
Well, I love working with you.
Right back at you.